We're here in the old apprentice school gymnasium on Marshall Avenue, where the basketball court has been transformed into a COVID-19 vaccination center. Newport News Shipbuilding is embarking on a massive campaign to vaccinate 25,000 shipbuilders. Crews have been working to get the center up and running and ready to go at a moment's notice once the vaccine arrives. Newport News Shipbuilding is categorized as 1B for the vaccine, which includes essential frontline workers. We've been working hand in hand with the local Virginia Department of Health office on the plan for NNS to receive doses of the vaccine. Task teams are coordinating the logistics of administering the vaccine to employees across all 3 shifts and are developing a vaccination schedule in accordance with CDC guidelines. It will be administered by the medical staff from the HII Family Health Center, or Quad Med. The first groups to receive the vaccine include first responders, essential personnel who man the facility during holidays and inclement weather, and employees over 60. We expect to receive enough vaccine for the entire workforce. We know there are concerns, so we sat down for a safe, socially distanced interview with Dr. Vijay Subramaniam, consultant to NNS, and Dr. Steve Apostoles, Newport News Shipbuilding's medical director, to talk more about vaccines, why you need to get one, and why they are safe and effective.
When we first realized that a vaccine was on the horizon, we pushed really hard to move up the priority list so we can protect our shipbuilders, because you're a national asset, and that's why we're so excited to have the opportunity to get you guys vaccinated.
All right. And so obviously the only way a vaccine works is if you get the vaccine. So this vaccine came about pretty fast in the scheme of things, correct? So there is a little bit of skepticism, people a little bit nervous about getting this vaccine. What can you tell anyone who's nervous about getting this vaccine?
From my standpoint, I'd tell you, go ahead and get the vaccine. The risk of having a reaction from the vaccine is much lower than the risk of actually having complications from COVID. I can tell you all my family members that are in the medical community, I've received the vaccine, and everyone I know, I'm telling them, go ahead and get the vaccine.
And doctor, you've gotten your vaccine.
It's a very seamless process. I had it done at the local health department. They did a great job. I just wanted to reiterate what Dr. Vijay just said. Even though they've briskly pushed the vaccine process through, there's still an incredible amount of science behind it. They've done lots of studies, and the side effects from the vaccine are minimal, and I'm very comfortable encouraging every shipbuilder to get the vaccine. I think it's finally our opportunity to, at the grassroots level, fight the coronavirus by all getting the vaccine done.
And so the shipyard working out all the logistics, but obviously it's going to be done in a safe manner, qualified medical professionals. If I do have a reaction, that kind of thing. Can you talk about that?
Sure. The CDC is very interested in anybody who has any types of reaction. So when I received my vaccine, they gave me a sheet to contact CDC if I had a reaction, and also Virginia Department of Health. So they're tracking all the reactions, and we want to give this vaccine to people in a safe manner. Well, the vaccines will be performed by people that know what they're doing. Just so everyone knows, the process is you'll go to get your vaccine. They'll ask you a series of questions to make sure that you don't have any COVID symptoms, that you haven't had extreme reactions to vaccines in the past. And then after you get your vaccine, you'll actually sit down for 15 minutes, and they'll watch you closely and monitor you and make sure that you don't have any significant reactions.
All right. And so race, gender, anything there that people need to be concerned about? Does it have the same effect? Are there certain populations that should get it over others, or should everybody get it?
Well, if we look at coronavirus in general, they found that the risk of either dying from the coronavirus, hospitalizations, or getting severely ill from a coronavirus is significantly higher in African Americans and Hispanics. when they did the vaccine trials, and this is actually for both companies' vaccines, they actually found that the side effect rate was across the board the same. It didn't matter on ethnicity. So like I said, the risk of the disease is much higher than the risk of a side effect from the vaccine. And they found, at least on the data that they've released, that it's just as effective in African Americans as it is in Caucasians. So when I looked at the recent data that was released for one of the vaccines, it was pretty much equal. They could not differentiate any side effect problems that were specific to a particular ethnicity.
And when you talk about African Americans and other populations, it's been a very deadly virus, more so for some people than others. We probably don't know exactly why, but it is still the most important thing is getting the vaccine, no matter what your race or gender is.
Absolutely. And again, the CDC data shows the risk of getting hospitalized or even dying from coronavirus is significantly higher in African Americans and Hispanics as compared to Caucasians. So, like I said, with the vaccine being proven to be effective with minimal side effects, and pretty much the major ones I hear is your arm hurts for a little bit. I would highly recommend getting it.
We talk about the flu shot all the time. People get the flu shot. It saves lives. Tell me, what you say to somebody who says, I'm not taking a vaccine that's only been around for a few months.
Well, first of all, this is a unique situation. We've never, been through a pandemic like this. So, I don't disagree with them. I don't try to get into arguments with people about it, but I do feel like they vetted this vaccine. And I think there's some, a significant push to get it out quickly because it's really the only way to get through this ultimately is if we establish herd immunity and the vast majority of us get vaccinated. So, I really encourage people to get the vaccine. I know that people are frightened, but as Dr. Vijay has eloquently stated, I'm certainly more frightened about contracting COVID. So I'll, love to answer anybody's questions. We'll do FAQs. Anything we can do to help alleviate people's concerns, we'll do that. Just want to talk a little bit about the logistics. The two vaccines that are out now, the vaccine will probably be getting, you get the shot and you will get a second shot in 4 weeks. So it's very important you get the second shot. You'll be reminded quite a bit, hey, it's time to get that second shot, and it's our expectation if you get the first shot, you'll get the second shot.
Right, and again, working out all the logistics at the shipyard, but obviously the folks that get the first shot will be communicated extensively on when and how they come back to get the second shot. So obviously that's majorly important. So talk about another kind of thing that I've heard. Yeah, maybe I'm fine right now, but in 5 years, what are they going to tell me? You shouldn't have gotten that shot because now look, you're having all kinds of health problems.
Typically with vaccines, the problems are usually up front. And they're keeping an eye on this. A lot of the people that have been vaccinated, they're already close to a year out on some of the original trials. So they're tracking this. It's not that once you get into the trial, you get a vaccine, they tell you go away. They're going to follow these people for 2 to 5 years. And so, like I said, most vaccines, the problems associated with them are just acute reactions, maybe a low-grade fever. You may not feel great, but that's up front. Afterwards, it's usually pretty well tolerated in most circumstances. The other thing is right now, everyone's really tired of wearing masks. The more people that get vaccinated, the goal is to eventually not need masks. It doesn't mean that as soon as you get vaccinated, you can throw your mask away. You're going to be wearing them for a while, but eventually we'd like to get rid of these.
And that's a great point. I think everybody will like that as well. So one of the other things is all of the underlying issues that people have. So a pregnant woman, somebody who's got immunodeficiency or disease or some other thing like that. We're going to have to communicate all of that, but what is the general guidance or what are your thoughts on that?
So the CDC actually, as part of the pre-vaccine, there's a checklist. And based on what you respond on the checklist, you're probably going to be asked to talk to your primary care physician or provider and make sure that they're comfortable with you getting the vaccine, you're comfortable getting the vaccine. And then as long as they're okay with it, the recommendation would still be get the vaccine. The American College of Obstetrics and Gynecology have been pretty much recommending people, even when they're pregnant, get the vaccine. These people were excluded from the clinical trials, but when they were just kind of looking at the overall picture, it's a risk versus benefits. The risk of someone being pregnant and having a severe complication from COVID is pretty high, so they thought the risk of the vaccine was significantly lower.
One of the other things is, so if I went out yesterday and got a flu shot, can I go tomorrow and get my COVID shot?
You can't, there is some regulations, and it's particular based on which vaccine you just received. So, I don't remember the exact dates, but if you did get the flu shot, you have to wait a certain number of days before you can get the COVID vaccine. That goes for the shingles shot. It goes for pretty much all the vaccines. And some of that is just in case you do get a reaction, you want to be able to differentiate which one it is. It's all spelled out in that sheet. It's going to tell you, hey, I had this, how long do I need to wait? I have this, can I get the vaccine? Do I need to talk to my doctor first? And that's very important. I take care of a lot of people with chronic lung problems. And one of the things on there, do you have a chronic immunosuppression? I'm actually recommending to my patients to go ahead and get the vaccines when they can. And, it's safer. Someone with chronic lung problems, they get COVID, the chances of them getting out, surviving it is slim.
If I have a reaction when I get my COVID shot at the center, is there someone there that's going to help me?
Yes, there'll be a physician or a mid-level, a nurse practitioner or a physician's assistant there. And, if you have a severe reaction, we'll take you to the hospital. So, yes, we have that all figured out.
And like you said earlier, but you don't get the shot and just get in your car and go home.
Correct.
So after I get the vaccine and a few hours later I'm at home and all of a sudden I start not feeling well or feel like I'm having a reaction, what is the advice?
Would depend on what type of reaction you're having, Brian. If you are having severe shortness of breath, difficulty breathing, you would call 911. If you have, mild aches, kind of flu-like symptoms, low-grade fever, that's to be expected. If that continues, I would reach out to your primary care physician and let them know that you just received the COVID vaccine, kind of go from there.
Okay.
And typically when you get the vaccine, you'll usually get a sheet that will tell you about the reactions that you'll possibly get. And they do give you some recommendations. Low-grade fever, you can try some medicine, some over-the-counter medicines. Severe pain, they'll give you recommendations on what you should follow after the vaccine. But if it's severe, you do want to get seen immediately.
So let's say again or reemphasize again about having a vaccine is much better than having COVID.
I've had a lot of patients with COVID in my practice. Some of them were some of the first people in the area to get COVID. As sick as some of them have gotten, I've seen people that were 40 years old, bodybuilders, come in wheelchairs just because they were so beaten up by COVID. I would absolutely just say, you know what, go ahead and get the vaccine. The chances of you having a reaction from the vaccine is significantly less. So I'm actually telling my patients that have even had COVID, yes, you're a candidate for the vaccine. The CDC recommends a waiting period, and I think it's typically around 90 days. But once you've hit that waiting period, you get the vaccine.
Yeah, and we have to tell our shipbuilders about that as well in our communications, that if you've had COVID, you need to wait 90 days, from your first negative test or something?
No, from a diagnosis,
okay.
Or if you've had the convalescent plasma.
And I just want to reemphasize, I just want to strongly state this. This is our opportunity, really to fight COVID. And, do it for yourself, do it for your family, do it for your fellow shipbuilders. Get the shot, because we can get through this if the vast majority of us get vaccinated. So, I think as we've talked about, there's going to be some people that have some mild side effects, but having COVID, I know that you've heard from other shipbuilders that have had COVID and how significant that can be. I don't want that to happen to anyone. We've done really well fighting this for almost a year now. We've opened our test center with Dr. VJ's help. That's worked extremely well. We're all confident that these vaccines will work well. I just want everyone to think it through, look at the science, get the shots.
You know, people worry about they're afraid of maybe a long-term effect from a vaccine, but what about long-term effects of COVID?
Yeah, I'm seeing people that are still having effects, and they were some of the first people diagnosed in March. I saw a gentleman just the other day that he's maybe 50%. They're talking about in literature people having chronic heart problems from COVID, absolutely chronic lung problems from COVID, memory issues. So it's better to prevent it than try and figure out how to treat it down the road.
So you all have both had your vaccination. So any hesitation at all?
Absolutely none. The process was very well done. The fact sheets are written for lay people, so you know, they explain every step of the process, and you know, this has been well thought out. You know, this is our opportunity to get ahead of this. So I truly encourage everyone to get it done.
You need to get the second shot.
Yeah, full disclosure, the side effects may be worse with the second shot, so we want everyone to be aware that that's a possibility. But those side effects are still mild. You know, malaise, fever, chills, kind of flu-like symptoms potentially. But you have to have that second shot to get the required immunity that will get us through this. So we can all make a difference if we get both shots.
Again, the vaccine is not mandatory for Newport News shipbuilders, but it is strongly encouraged. It's also important to note that if you can get the vaccine through your healthcare provider or some other means, you should go ahead and get the vaccine that way. There will be much more information coming out about the program, how you will get your vaccine, and why it's so important. In the meantime, everyone can learn more at the Center for Disease Control website and their frequently asked questions page about vaccine safety. And make sure you check out all the latest information at the Newport News Shipbuilding 411 website. For Focus NNS, I'm Brian Moore.